Macular degeneration is one of the leading causes of blindness in older adults. In our previous video, we discussed what AMD is and its risk factors. For today's video, we talk about treatment and preventive measures for AMD. Unfortunately for AMD, lost vision cannot be reversed, so the disease technically has no cure. The best we can do is to slow down the disease progression to make sure that patients will not progress to geographic atrophy or wet macular degeneration so that patients can retain at least some form of usable vision for the rest of their life. That's today's video. Let's take a look. Hi everyone, welcome to my channel. This channel is dedicated to providing you with the most informative and up-to-date eye care information so you know how to take care of your eyes and vision. If you're new here, smash the like button below and turn on the notifications so that you won't miss any of my future videos. You can also leave your suggestion for me, if you have any, in the comment section below so that I know how to make my videos even better. When it comes to AMD, the appropriate treatment depends on the stage of the disease. For dry macular degeneration, there are no particularly effective treatments for either halting its progression or reversing lost vision. The only treatment available now is a well-balanced diet including low cholesterol and more leafy green vegetables. Retina specialists may also advise patients with the intermediate stage of AMD to take supplements of vitamins studied in the age-related eye disease study called ARES-1. ARES-1 was a clinical trial sponsored by the National Eye Institute in the United States to study the effect of high-dose antioxidant and zinc on the progression of AMD. The study followed 3,640 individuals for an average of 6.3 years between 1992 and 2001. The researchers concluded that high levels of antioxidants and zinc can reduce people's risk of developing advanced AMD by about 25%, while also reducing the risk of wet macular degeneration. ARES-1 supplements contain 500 micrograms of vitamin C, 400 international units of vitamin E, 15 micrograms of beta-carotene, and 80 micrograms of zinc in the form of zinc oxide, and 2 micrograms of copper. Copper is put inside not necessarily because copper helps with AMD, but because high levels of zinc intake inhibits copper absorption. So copper is put in to avoid copper deficiency anemia. It is important to note that supplementation doesn't help with the early stage of macular degeneration. Because of that, no general recommendation can be given for the consumption of dietary supplements as a preventative treatment. You should also be aware that taking supplementation is not nearly as effective as smoking cessation. In 2006, a 5-year follow-up study called ARES-2 sought to determine whether the formulation might be improved by adding omega-3 fatty acids, lutein, and zeaxanthin, removing beta-carotene, or reducing zinc. The result is a little disappointing. Adding lutein and zeaxanthin doesn't help with disease progression. However, the study also found that beta-carotene raises the risk for lung cancer in current or ex-smokers. This is likely because the antioxidant in cigarette smoke can oxidize beta-carotene. In the end, researchers removed beta-carotene from the combination and added lutein, zeaxanthin, and omega-3 fatty acids while substantially curbing zinc concentration. The combination ARES-2 is now 500 micrograms of vitamin C, 400 international units of vitamin E, 25 micrograms of zinc in the form of zinc oxide, 2 micrograms of copper, and 10 micrograms of lutein, 2 micrograms of zeaxanthin, and 1,000 micrograms of omega-3 fatty acids. The combination of lutein and zeaxanthin is just as effective as beta-carotene, and they are great supplements to daily diet because zeaxanthin can be hard to get from what we eat. Compared to dry macular degeneration, wet macular degeneration is much more progressive and can lead to severe vision loss. Luckily for wet AMD, an effective treatment is available by intravitreal injection of a medication known as anti-VEGF. In wet macular degeneration, a signal protein called vascular endothelial growth factors is released and stimulates the proliferation of abnormal and leaky blood vessels. The anti-VEGF medication binds to the VEGF, inactivating them so that the VEGF cannot bind to the receptors. inhibiting the formation of leaky blood vessels. Yes, needles coming toward the eye does sound intimidating and pretty close to what we see in horror movies, but in truth, most people receiving the injections only report mild discomfort, pretty much to touching the eyes in search for lost contact lens. There are 4 FDA-approved drugs for treating wet AMD. They are Macugen, Lucentis, Eylea, and Beovu. Macugen is the oldest one, and nowadays, doctors rarely prescribe it because the other 3 are far more effective. A 5th drug, called Avastin, is FDA approved for treating several types of cancer, but it can be used off-label to treat AMD. The downside of anti-VEGF therapy is that the medications only last temporarily, and patients need injections at regular intervals for several months to several years. The frequency of injections depends on the medication. Generally, Lucentis is given monthly, Eylea bi-monthly, Beovu every 3 months. However, injection frequency can be extended as long as disease activity remains controlled. Researchers suggest that Lucentis, Eylea, Beovu, and Avastin are all highly effective for AMD. The major difference is their cost. Avastin is roughly $60 to $70 per dose versus up to $2,000 per dose for the other 3. Check your insurance plan or Medicare coverage to see how much of the cost you need to shoulder, if any, if you choose this therapy. Yes, these injections can get very expensive over time, so make sure you have a reliable insurance coverage. So, what are the risks of intravitreal anti-VEGF injections? Because the anti-VEGF medication acts on the blood vessels, some doctors have concern that these drugs might increase the risk for strokes or other vascular events. So far, there is inadequate evidence supporting the possibility that this medication increases the risk of cardiovascular events. This theoretical risk is still important to discuss with patients. In rare cases, severe intraocular infections or endophthalmitis can happen. This is when pathogenic microorganisms enter the eye from the injection site and infect intraocular structure. Endophthalmitis is a medical emergency and requires immediate care. Doctors will perform an emergency pars plana vitrectomy to remove the infected vitreous humor and inject the eye with antibacterial or antifungal medications. The prognosis of intraocular infections largely depends on how quickly you get it treated and the virulence of the pathogens. Unfortunately, in the vast majority of cases, it does not have a favorable outcome, and many patients will at least have some extent of vision loss. However, keep in mind that infections are rare. The risk is roughly 1 in 3,500 or maybe 0.029% per injection. In addition to anti-VEGF medications, laser surgery is a possible and uncommon treatment option for wet AMD. Laser photocoagulation is a procedure in which doctors use a laser to carefully cauterize the abnormal blood vessels to seal them and prevent further leakage. People reap the most benefits when the procedure is done on the newly formed vessels that haven't yet encroached on the fovea, which is the central part of the macula, which provides the clearest vision. Unfortunately, such cases are rare because most patients with wet AMD already have blood vessels formed adjacent to or under the fovea. Laser photocoagulation can be done in the doctor's office and takes only a few minutes, although sometimes multiple treatments are necessary. The surgery is often helpful and can restore vision, but about half of people who have it see a return of symptoms and may need more laser treatments. Laser surgeries for AMD are not frequently performed due to 2 major drawbacks. First, it cannot prevent the growth of new blood vessels, and it can mistakenly destroy healthy tissues on the retina. Furthermore, laser surgery cannot alter the disease progression in wet AMD, and many patients see their conditions relapse without the aid of anti-VEGF medications. In general, lasers are used only when the leaky blood vessels are relatively small and located far from the central portion of the macula, or when someone cannot have intraocular injections because of an eye infection or advanced glaucoma. Very few people fall into these categories. The best treatment for AMD is always eliminating modifiable risk factors, no matter what stage you are at. One notable one is to quit smoking. Smokers are up to 4 times more likely to develop AMD compared to non-smokers. Smokers already diagnosed with AMD have a higher risk of progression and a higher chance of developing the wet form of the disease. Not only that, smokers with wet macular degeneration respond poorly to anti-VEGF therapy compared to non-smokers. Therefore, quitting smoking is the best way to slow disease progression and subsequent vision loss for smokers with AMD. Alright, so these are pretty much the treatment options for age-related macular degeneration. As the global population ages, AMD is quickly becoming a major cause of blindness in people's 60s. AMD mainly affects people's central vision, so people still preserve their peripheral vision, no matter how advanced they are in the disease. However, impaired central vision can be extremely debilitating. All patients with dry AMD should be educated on the importance of regular at-home Amsler grid tests to check for metamorphosia or scotoma that may indicate conversion from dry to wet AMD. Patients need to contact their ophthalmologist immediately if they notice any sudden change in vision, because the sooner wet AMD is treated, the better the prognosis. Keep the Amsler grid on the refrigerator door or in another convenient spot so that you won't forget to use it once a week. Thank you so much for watching, everyone. Yes, I know the content in this video can be hard to hear. The field of ophthalmology has so many limitations. There's no way that we can bring lost vision back. Yes, as humans, we still have a very long way to go. No matter how far it seems, scientists have been working on bringing lost vision back, not just for AMD, but also for other blinding eye conditions, and hopefully, one day we will. Take care of yourself, and be well.
Sometimes multiple treatments are necessary.